Hello, everyone. I'm Todd Montigney, Managing Director of BlackTree Healthcare Consulting, and welcome to this month's edition of our Thought Leadership Program. So today I have Maureen Kelleher, Clinical Manager of BlackTree, and also our hospice and palliative care expert. So while we have her on here today is because we've getting lots of questions from our providers in regards to palliative care. We want to share those questions and answers with you so you can help better position your company for success. So the first question I have for you, Maureen, is what is the benefit of a palliative care program for healthcare?
Thank you, Todd. I'm glad to be here. So the benefit for palliative care in healthcare is that palliative care is that safety net for patients. So if you have home health or hospice or personal care agency or even a hospital or a doctor's office, palliative care helps capture those patients who are in between all of those different service lines. So what it does for, say, a hospice program that wants to start palliative care is that it captures patients earlier in the diagnosis process, way before they need hospice. But it helps, the visits help patients start thinking about what is quality of life, how do they define it, and how do they want this disease trajectory to proceed. Some patients will get better and they won't need palliative care. Other patients will move through different service lines until they're ready for hospice. And then what statistics have shown is that palliative care actually helps with the care of the patient. It helps with the effectiveness of treatment while they're being treated for curative treatments, and it helps patients get on to hospice sooner rather than the last few days of life.
Yeah, and I know like we talk with different types of providers. We work with all different types of providers at BlackTree. What type of providers should consider starting or creating a palliative care program?
So the nice thing about palliative care is that almost any kind of healthcare provider can actually get into palliative care. There isn't a terminal certification for palliative care patients. They can come on palliative care right when they're first diagnosed. So a primary care physician could set up a palliative care to kind of follow and do symptom management treatments. Hospitals, a lot of hospitals around the country have inpatient palliative care, but when the patient goes home, there's nothing. So it's setting up community-based or clinic-based palliative care programs. Specialists, oncologists, cardiologists, pulmonologists, renal disease specialists, dialysis companies, home health, private care, and hospice. All of those programs could benefit from looking into a palliative care program.
That's great. Yeah, obviously it goes beyond just palliative care by itself or just a hospice agency having a palliative care program. So next question, shooting back out to you, is what would an agency need to know to start a palliative care program? At least we're hearing a lot of our clients in the hospice world considering it, or if they have a home health and hospice considering it. What should they be considering to start a new program like this?
So the first thing to consider, especially for home health and hospice programs, is that palliative care is done under Part B billing with Medicare. So if your primary patients are Medicare, Part B billing is very different than Part A, and you have to understand what that looks like, what the codes look like, what the visits need to document in order to support the codes. It also should be set up as a separate entity. It can be under an umbrella of home health or hospice or another type of healthcare program, but it should be its own entity with its own NPI number and its own submitter ID. So all those forms, the 855s and 460s and 588s, all those Medicare forms all have to be filled out. So there's a lot of paperwork to get to the first patient before you start actually providing palliative care.
In what settings should a palliative care program, where should they actually be providing the care at? And one thing I just want to piggyback on your last answer was, from a billing perspective, there is the 20% copay for Medicare patients that you're going to need to build a patient or the next co-insurance for. So that's a whole other dynamic to to the billing that we're used to in the home health or hospice world. But back to my other question is, what type of setting would you be providing palliative care in?
So palliative care is typically provided either inpatient in a hospital or acute care setting, in a clinic setting, just like a specialist, you would go to the doctor's office and see the palliative care specialist, or in the home setting. Those are the three primary settings. There are several the inpatient palliative cares that are set up in nursing homes. You can also look at, in an assisted living or independent living, having some type of office set up for a palliative care specialist to come and see patients in that setting as well. So there's a variety. It's just, you have to know the rules for each setting and what the quality metrics are for each setting and what the requirements are for each setting.
Great. And my final question for you, and then you're off the hot seat, is your final thoughts. What would an agency need to know to start a palliative care program?
Okay, so they would need to know how many competitors there are in their area, how many other healthcare lines have palliative care, and if they do, is it just inpatient? What I'm seeing in most counties across the country is that a lot of people have the inpatient settings for the hospitals, but nobody has the community settings. So you have to look at who your partners are. Sticking with the 4 primary diagnosis settings, heart, lung, kidney, and cancer, you want to make sure you have some good relationships with those specialists in your area. And the biggest challenge is being able to explain to them and work with them on how palliative care will benefit not only their patients, but themselves. What are you taking off their plates that they no longer have to worry about if you're doing palliative care? If your nurse practitioner can go out once a month or every other week and see the patient in the home and take care of some of those late night calls, however you set up your program, that takes some of that pressure off of the doctor, and then they're working with another healthcare professional to develop that care plan. So it's not that you're taking over for the primary care or the specialist, it's you're working in conjunction with them. And when you set up that rapport with those specialists and those professionals in your area, your program has a tremendous amount of quality built into it. So the biggest thing is your network, understanding the forms and being able to bill. If you're working with third-party payers or Medicare Advantage, you have to know how to negotiate contracts and get credentialed with all of them. But above all, you want to be able to support and justify the quality of your program. So you have to choose really good quality metrics. And now that Medicare is working on all of these different programs, between the serious illness program and direct contracting and all the value-based incentive programs, the more they go into these quality-based programs, the more palliative care is going to be on the front lines for this, because that's going to help all these other healthcare professionals maintain their quality metrics, reducing hospital readmissions, reducing emergency rooms visits. And patients are going to feel like they're cared for, they're protected, and that they have a safety net, when in most cases, up until the last 10 years, they may have fallen through the cracks.
Yeah, all great insights. And that's everything you just said there is one of the main reasons we're probably hearing so much from our clients and questions in regards to this, or getting the program off the ground for the first time ever. So I appreciate you being here with us today. And if anyone has any questions in regards to services BlackTree offers to support you with this program, either help you grow it or help get one in place, feel free to reach out to us, and we'd be more than happy to help you and answer any questions. So thank you.
Thank you.